That was a randomized study comparing momelotinib and danazol. Right? The danazol is the anabolic steroid that is being used for myelofibrosis because it makes people feel better and it can improve the anemia to a degree. None of this is extraordinarily good. It's used because we don't have a better. It's not approved as a therapy for myelofibrosis. It's listed, however, as a therapeutic approach in national guidelines. So it makes sense to compare it for control of the spleen and anemia in a blinded way, to use it as a comparator in a blinded way versus momelotinib. So momelotinib won in the improvement in quality of life. If you want to go by the percentages, I do have exact numbers here. So making people feeling better, and we measure that by implementing the questionnaire. So objective, semi-objective way of looking at improvements. And we say how many patients improved their symptoms by 50%, half of the symptoms gone. And that was 25% on momelotinib versus 9% on danazol. So as I said, danazol is modest, not much here that you can do. So 25 versus 9 is very good result. The next was a transfusion independence at 6 months after therapy starts. And that has two factors. Some patients are transfusion independent at the very beginning, and maintaining them transfusion independent, plus adding the patients that become transfusion independent, that were requiring transfusions but not anymore. These two together, that is the transfusion independent status at 24 weeks, and that was a 31% for momelotinib and 20% for danazol. This was non-inferiority between the two. However, I should say, when we look at the percentages of patients that changed during these 6 months, this is the different way of looking at it. This is called the rate of no transfusions during the 6 months, right? The rate of transfusions during the 6 months. Here, that was seen in a 35% of the patients on momelotinib and 17% on danazol. That's very valuable. Why? So you can say a third of the patients had no transfusions by week 24. A third, that's a really good number, actually. So 35 versus 17, and that's a superiority. So that's how I look at the benefit of anemia. Not only the state at one point in time, but how things improve, right, over 6 months of therapy. And then the improvement in the spleen. And here, after 6 months of therapy, and this is done by measuring the volume by MRI, a 35% volumetric reduction in the spleen, which usually corresponds about half gone by palpation. That was seen in about 23% of the patients on momelotinib versus only 3% on danazol. So again, modest danazol and very good result in a second-line setting. Remember, this is people who were previously treated with JAK inhibitor for the symptoms and the spleen. 23% of them had this response, which usually again means half gone by palpation. So you have here a combination of three factors in a very good proportion of the patients. Certainly for a situation where the study was done in a second-line setting, quite amazing result. No other drug can do that and cover all the problems at the same time. You can envision that some other drugs perhaps can counteract the spleen. There, fedratinib I mentioned as a possibility, as a therapy that is approved 2.5 years ago, possibly can counteract the spleen in the same setting, but at the expense of causing anemia in half of the people. So not much to use then, unfortunately, in this situation for such a drug. And so the spectrum of patients that would be using momelotinib if it gets approved is very large. Majority, I would say, great majority in a second-line setting, and some patients in front-line setting, as we said before.